So good morning, everyone. Thank you so much for getting up so early and coming before class to hear about Initiative 502. As Jeremy indicated, I am the Outreach Director for New Approach Washington, which is the organization that put forward Initiative 502, collected 355,000 signatures last year to qualify it for the ballot, and that's what every voter gets to vote on in Washington State come November 6th. I'm a former prosecutor for the city of Seattle as well as the city of Wenatchee. I have enforced our marijuana laws by putting people in jail. In Washington State, it carries with it a mandatory minimum of a 24-hour jail sentence if you're convicted and a $250 fine. Before I get into the details of 502, I want to talk a little bit about policy, and I first wanted to start off by saying, and I couldn't agree more with what you just said, that marijuana is not a harmless drug. There are negative consequences for using any drug, whether it's marijuana, tobacco, or alcohol, particularly amongst youth. And that's why 502 was carefully designed to protect the health and well-being of youth within Washington State. It will not make it legal for those under the age of 21 to use marijuana, and that's why 502 has been endorsed by doctors, law enforcement officers, and child advocacy groups such as the Children's Alliance. The real sad fact is that our current marijuana policy is not working. Violent cartels are making billions of dollars selling marijuana in the United States, and we're getting none of the benefit from that. And in fact, we're not really being successful in curtailing access to marijuana for adults or for youth, or use of marijuana for adults and youth. Our current laws are also wasting law enforcement resources. Instead of being able to focus on violent criminals, we are instead wasting $213 million in the last decade enforcing adult marijuana possession charges. Again, we're not preventing people from having access. In fact, 12th graders, which I'm sure, how many 12th graders do we have here in the audience? Wow, there we go, a lot of them. 12th graders have reported in Washington State that in the last month they are more likely to have tried and used marijuana than a tobacco cigarette or any other tobacco product. So we're not doing a very good job of educating and talking about the risks that come with choosing to use marijuana, because again, there are risks. I'm sure you will be speaking to those specifically. So 502 really looks at a new approach, a public health approach policy that would shift using the criminal justice system for adults and use a public health approach that would take the money out of the hands of the cartels and put that towards treatment, prevention, and science-based education that we know can work, again, looking at the tobacco model. 502 has tight regulation and taxation, again, so that we can undercut that black market. And there are provisions written into 502 to ensure that we're evaluating this law and ensuring that we're not creating any negative consequences for Washington State by the implementation of this law. There is strict advertisement restrictions when it comes to minors. And again, the main point of this is shifting away from the policy that we have been using, which is the criminal justice model, to a more public health model. 502 really feels that we can look at the success that we've had with tobacco. We haven't arrested a single adult for tobacco use, but we've been able to affect the norms when it comes to tobacco. We've been able to affect the norms when it comes to how people perceive tobacco, and have been able to do a better job of educating and being smart so people can make healthy choices without facing the criminal consequences that come from a criminal conviction. And again, this only legalizes for adults 21 and over, and I know there might be some concern out there for the new DUI provision that's been implemented. Again, 502 creates a 5 nanogram of active THC DUI for those 21 and over, which is comparable legally to our .08 that we have for alcohol. 502 believes that this is a public health policy, a public health approach, and a public safety approach, because we want to stop using the criminal justice system to prosecute adults, but we also want to keep our roads safe by imposing this per se limit. It is zero tolerance for those under 21. Again, it's 0.2 for alcohol for those under 21 as well, because we do know that youth are at higher risk drivers, which is why I'm sure a lot of you have higher insurance policies on your vehicles. Again, this is a concern that we wanted to keep in mind as we take a step towards ending the war on drugs, ending prohibition of marijuana, and again, having a more public health approach. I will get into more details. I'm sure you guys have questions about the details of the initiative, but I just wanted to do that as a foundation for why 502 is that step that we want to take and feel confident that those of you that are able to vote, if you're 18 and over, can vote yes on Initiative 502.
Okay, thank you. Anthony, I noticed you shaking your head, so I'm sure there's already something that you disagree with, but you have your introduction.
Yeah, definitely. My name is Anthony Martinelli. I'm from an organization, Sensible Washington, and I work as the communications director. And you can go to sensiblewashington.org to find out more about us. We're a nonprofit in our group which stands for Repealing Cannabis Prohibition for Adults in our state. We consist of about 10,000 volunteers, and we agree entirely with the message of Initiative 502 that we need to legalize and regulate cannabis. Cannabis prohibition, no matter which way you look at it, has failed. It is what it's caused is an enrichment of criminal organization. We've taken a huge cash crop that could produce a lot of jobs and tax revenue, and we've handed it to criminal organizations that have benefited from this, and they've benefited from the artificially high prices that prohibition creates. And what we've done is we've taken nonviolent individuals and put them in prison. And so, for that reason, Sensible Washington has been working since 2010 to repeal cannabis prohibition for adults 18 and older. Our initiative coming out next year will be 21 and older, but we will extend juvenile jurisdiction up to 21. We, as an organization, stand firmly in opposition to Initiative 502. We voted 12 to nothing after multiple weeks of looking it over, and there are a lot of reasons for that. And to get to it quickly, the whole distribution system that it's being set up, the taxes that it's stating that it will raise, the benefits it is stating that it will bring just won't really come about because it actually keeps cannabis a Schedule I drug next to heroin under state law. And proponents try to say that this doesn't matter when in reality this does matter because this means that it doesn't legalize cannabis. So it's trying to regulate and license something that it doesn't legalize. And one of the main reasons we oppose this initiative as a legalization group is the DUID policy that was implemented. And I'll say first off, if you're under 21, the only thing this initiative changes for you, literally the only provision that affects you for under 21, is it implements a new zero-tolerance driving policy. As an organization, we don't condone youth usage at all. We believe if you're going to use cannabis, you should wait until you're 21. But our state voters have declared for over a dozen years that you can be a patient under the age of 21 if you're qualified. So between the ages of 16 to 21, you can be a qualified patient. Yet this initiative implements a zero-tolerance driving policy. And this is for everybody. This means that if an individual decides to try cannabis at a party, 1 month or longer after they consume that cannabis, they will fail the DUID policy and get a penalty for driving under the influence of drugs, which will affect your life forever. It will stop you from getting college grants, it will stop you from getting jobs, and in certain instances it will stop you from getting apartments. And this is for something that you might have tried a month ago. And again, we don't condone youth usage rates at all, but this doesn't make any sense because what this is doing is pushing youth to other substances like alcohol. Because alcohol, you're not going to fail a DUID test the next day. With this mandate, you will fail a THC DUID test the next day because the studies that they use to justify their adult limit shows that even active THC lingers for up to 30 days or longer after last consumption. And yet they're making it so that any detectable amount of THC, any detectable amount, is a guaranteed conviction. You can go in and defend that the test wasn't right, you can go in and defend a couple small things like that, but you can't go into court and defend that you weren't impaired. You can't go into court and say, I accidentally ate a pot brownie at a party 2 weeks ago. You can't argue that because it's per se, meaning any detectable amount of THC makes you guilty. And for adults, the limit is 5 nanograms, and that's arbitrary and unscientific as well, because that's a limit that science has shown will be rejected days after people last consume cannabis. The science that proponents use to justify this limit, which is a government-funded study by Dr. Aaron Karshner, they use that to justify this limit. Dr. Aaron Karshner publicly states that she's against this limit, that if she had to set a limit for cannabis, it would be 15 to 20 nanograms per milliliter. So this is one of the main reasons we're against it. It's one of many, and you can go to our website, sensiblewashington.org, to get our full 8-part analysis. But we believe very strongly that this will lead to prosecution of innocent people. And in our own state, just last year, State Rep. Roger Goodman introduced an even higher 8 nanogram per milliliter limit for THC, and he revoked it because he realized really quickly that it would lead to prosecution of the innocent and because of the public backlash against it. So what we have here is a new prohibition on cannabis and a new penalty for kids who do decide to use cannabis, even if they're patients, even if they're a 20-year-old qualified patient that has cancer. It's a zero-tolerance driving policy for them. This is not fair policy. And when you look at the rest of the initiative, it's just a faulty piece of law. The way that it's written, again, it doesn't remove any criminal penalties that makes cannabis illegal, and it keeps cannabis a Schedule I drug. So the entire licensing system, which forces growers and sellers to submit their fingerprints to the FBI, the entire licensing system won't come about, and this won't bring the benefits that legalization will bring. And because people can legally possess an ounce under this initiative, but they can't grow their own, and they can't go into a store and buy it because of preemption issues, this is going to force people to the black market to purchase their legal ounce. This isn't going to benefit any way. This isn't going to bring any of the benefits that legalization will bring. And I urge all of you to look into this initiative and to read it and to look into the studies. And if you're on the line about legalizing cannabis, I urge you to look at that as well. Go to sensiblewashington.org. We have a list of reasons of why we should legalize. We have a list of scientific studies declaring the medical benefits of this. And I urge all of you to look into it, and I thank all of you for being here.
Okay, thank you, Anthony. I'm sure there's material that will come back to you from what you just said. All right, so Derek, another perspective on I-502?
Yeah, thank you, and good morning. I'm Derek Franklin. I'm with the Washington Association for Substance Abuse and Violence Prevention, and indeed the title of my organization is a bit of a giveaway as far as my position on legalization. And yeah, I disagree with my friends on the stage, Ms. Winchester and Mr. Martinelli, in that I'm opposed to legalization and 502, and a few reasons why. I think it's from a prevention perspective, and that's my job. My history is I've done mental health therapy for kids and families. I've done drug treatment for kids and families. I currently work doing prevention.